Hello and welcome to the last session in the Human and Social Services track of Iowa Ideas 23. My name is Marissa Payne and I'll be your moderator for today's session on homelessness and wraparound services. So this session will look at a client and resource perspective on needs analysis and intake experience when it comes to serving the homeless community. How and when are wraparound services considered? How are service-based organizations consistently considering multiple needs when encountering a client? And what are the challenges when collaboration for services is the best course of action? So I will hand it over to our panelists to introduce themselves. I will start with Karen.
Hi, everybody. My name is Karen Hyatt, and I work for the Department of Health and Human Services. And I'm an emergency mental health specialist, the disaster behavioral health coordinator for the state, and that translates into program and policy planning. I work with PATH, which is Projects for Assistance in Transition from Homelessness, manage those contracts. And I'm also the lead in Iowa for the SSI Outreach, Access and Recovery, and then work on connecting state level programmings back to community-based services in regard to housing.
All right, thank you. And Linda.
Morning, everyone. My name is Linda Munden. I'm the Senior Executive Director here at the Bridge Home in Ames, Iowa. We serve a 5-county region called Two Rivers here in central Iowa. We serve Greene, Boone, Story, Marshall, and Hardin counties. We provide a continuum of homeless to house services, including shelter, gap, diversion, outreach, rapid rehousing, and supportive housing. My job is I oversee supportive housing, rapid rehousing, and street outreach, as well as write and administer the major grants here for the program.
Thank you. And Sarah?
I'm Sarah Buck. I'm the Housing Services Manager for the City of Cedar Rapids, and our office oversees we're the Housing Authority for Lynn and Benton County. So the Housing Choice Voucher Program, or formerly known as Section 8 program, as well as additional federal funding that comes through the city for housing and social services. I will say a couple of the exciting projects that we've worked on here recently is we are utilizing 4 different federal grants to rehab a former office space into 25 affordable housing units, and that project is underway. We will then gift that building to an entity to own and operate for a 15-year affordability period, and we're in the process of looking at possible owners right now. And then also we had the National Alliance to End Homelessness come into our community and do a design systems clinic to really look at our system design clinic to look at all of our data and our services that we provide in our community revolving around homelessness. And they provided some recommendations that we're now working on. So, thank you.
Okay, thank you. And our last panelist is Deneen. Can you hear us now, Deneen? She's been having some tech issues here. Deneen, can you hear us?
Yes, on my phone. Can you guys hear me?
Yes.
Okay, great.
Okay, so Deneen's going to listen to us from her phone, but we have her audio.
We're doing intros, Deneen. Do you want to introduce yourself?
Okay, I'm sorry. Can you guys repeat that?
We're just doing yeah, sorry. We're just doing intros. Can you introduce yourself?
Yes. Good morning, everyone. My name is Deneen Rushing, and I am the Shelter Services Director at the Willis Day Homeless Services Agency.
All right. Thank you all for being here, and thank you to our sponsor, ITC Midwest, thank you all for being here. Sorry, audio issues threw me off a little bit. Okay. So let's get right into it. So the events of 2020 with the pandemic, and especially at least here in Cedar Rapids, the derecho, have had a major impact on our housing needs and contributed to increasing homelessness. What has that meant for homelessness in Iowa and in your communities?
And I can start if that's helpful. So yeah, in 2020, obviously dealing with the COVID-19 pandemic, And then kind of the double whammy of having that inland hurricane come through the city of Cedar Rapids and really did some substantial devastation to a lot of our all of our housing. It really touched every bit of Cedar Rapids and most of Lane County, but really devastated a lot of our affordable housing apartment complexes, as well as single family dwelling. All of that said, pre-pandemic, we were seeing probably about roughly 45 individuals that were on the street experiencing homelessness during our point in time count pre-pandemic. During the pandemic, because of all of those things that were happening, we did have an overflow shelter that we typically would provide during just during the months of the cold months of the winter that we left open because of all of the other services in the community were really shut down because of COVID-19, and then that added derecho impact. We left that open. It was just over a year and had those services 24/7. And what we saw was really an increase. So the most recent point in time count, I think we were upwards of 125 individuals that were found on the street. So substantial increase in individuals needing assistance and then actually just living literally on the street or in places not meant for human habitation.
We've seen through the PATH program, we serve 7 metropolitan areas, and because of the pandemic and when people were allowed to stay in their apartments, which really helped them, right? But then there were people who had been waiting to rent those apartments that then could not because people weren't leaving, didn't have to leave. And so that helped them, but it also then hurt this other segment of the population that had been waiting to move into those openings. And when that period ended and landlords were able to evict people, then there wasn't a place for people to go. And we've seen an increase in deposits, and a lot of places now post-pandemic that used to require 1 month, maybe 2, are now requiring 3, maybe 4. And so we're seeing a huge impact in that and the way that we deliver the services.
And I can kind of follow up, hopefully quickly here. One of the things that we had going on here was that as far back as 2018, we had a tornado go through and do a lot of destruction in Marshall County, and folks had barely begun to recover from that when the derecho went through and 2020 there and did a lot more damage. And what we saw then with the pandemic is in FY20 there, we saw 9,000 shelter bed nights for our program, and it jumped to 13,250 some in the following fiscal year. So we saw quite an increase there. Now we were fortunate enough with the pandemic that we were able to get what's called the HUD ESG Emergency Solutions Grant funding for COVID, and we had the total between the 2 different grants there, $1 million or so in funding, and that really helped us with our shelter, because we had to shut down our congregate shelter because we couldn't keep folks safe. And there were times, just the names, when we had 15 or so motel rooms open a night, and we had to use motel rooms in our outer counties because the congregate shelters had already shut down in Boone and Marshall counties in 2017. We're regional program, comprehensive regional program. So that really hurt. But what happened when the CDC eviction moratorium came into play was, that was great in one way, but at the same time, folks who invoked the eviction moratorium were able to stay in their apartments, but then property owners weren't able to pay for maintenance in a lot of cases, and then they weren't able to maintain their own livelihoods. And then that did back up a lot of evictions. And then on the other hand, too, our agency was sitting on HP homeless prevention funds that we couldn't spend because our folks who needed the services weren't able to be eligible for those funds. The CDC eviction moratorium and the ESG homeless prevention funds, they were kind of at cross purposes with each other because one made folks ineligible for the other one. So that was very difficult. So there was a huge backup of evictions, and then folks became eligible for those funds all at once, and it was quite a mess. So yeah, that's kind of my contribution to that question there.
And Deneen, I'm curious from your perspective, like what are we seeing on the ground with homelessness, and what are kind of some of the common reasons that you're seeing at Willis Stady among your clients, for why people become homeless, and what does that look like right now?
Yes. So what we're seeing, I'm sorry, do you guys hear an echo? When I'm talking, okay. So what we're seeing here at Willis Stady is that, kind of similar to what everyone else has mentioned, is that there definitely was a ripple effect that occurred, after the pandemic and derecho. As Sarah had mentioned, we were operating the overflow shelter 24/7. So we had about 75 individuals there per night, plus the 50 individuals that we had in shelter at Willis Stady. And as Sarah mentioned, there is a population of individuals that were sleeping outside also. And so when the pandemic and derecho occurred and the moratorium was set in place, individuals were able to stay in their places a lot longer. But once the moratorium was lifted, a lot of landlords were out of a lot of money. And so what we saw then at that point is that a lot of landlords that we were able to rent to before had either sold their properties or they had now hired third-party property management companies to come in and oversee their properties. And so what that meant for our clients is that a lot of our clients no longer qualified for those units. And so what we started to see is that individuals are staying longer in shelter. We are a 30-day shelter, but we also are housing first. And so when clients check into the shelter, we're definitely focused on creating a housing plan immediately. But we are seeing those longer stays. Right now, just to give you a little bit of statistics, our average length of stay is about 90 to 100 days for individuals. And the reason being is that it just takes a little while longer to be able to get individuals housed. One thing that we're focused on here at Willis Stady is to try to create those stronger relationships with landlords. If we could, create some incentives where we let landlords know if you have issues or struggles with clients and individuals that we're getting into your property, give us a call. This may be a situation where we could step in as case managers to try to, mediate the situation. Another thing that we've tried to do is provide those services in shelter on site while individuals are here waiting, to get into their housing. So while we have them here doing the tenant academy that Waypoint provides, also addressing some of those more severe barriers as far as like childhood trauma and adult trauma and those things. We want to address those things on the front end to hopefully help clients to be more successful in long-term housing when they do move out.
Yeah, so when you're working with someone experiencing homelessness as a service provider, how do you determine what services and support they need?
That's a great question, and this goes back to the case management piece, making sure that the case manager is meeting with the client immediately when they check in. So one expectation that we have is that when clients check into the shelter, they're automatically assigned a case manager. And so it's 24 to 48 hours after they have checked in that we have scheduled the one-on-one meeting for them to meet with the case manager. And so once they sit down with the case manager at that initial meeting, we want to figure out how this individual ended up at the shelter, because we want to address whatever barriers that they may have that would prevent them from being successful in shelter. Once we're able to identify those, then we point clients in the right direction to obtain those resources. So for instance, let's say we have an individual that comes in that has a mental health component, but they're not currently on their medication. We do work very closely with the Abbey Center. They actually come into the shelter a couple times a week, and they provide peer support. And so, having those resources readily available is really helpful in addressing what those barriers are that clients have. We also have ASAC that comes into the shelter a couple times out of the week and can provide those substance evaluations, right here on site. We also have been able to partner with Tanager Place, where we have a therapist on site So just working through whatever those barriers are that clients have, and then making sure that the resources are readily available for them to be able to utilize.
Would anyone else like to jump in on this one?
I think that Deneen kind of nailed it when she said there's a process, right, to getting people into housing and then helping them stay in the housing once they obtain it. And we certainly want to help people with feelings of isolation and helping people learn how to follow the tenant, the landlord expectations, follow the property's wishes in a way that benefits them as well. But it's hard to do that because all of that is timing, and there are other programs that might not have the same extensive offerings that what Deneen's shelter has. And so we try to get those from other places, right? So it's like one agency can submit and do something with outreach and getting a person into coordinated entry, and then another agency pulls that name and then they add on to that with case management, maybe from Medicaid. And so it's really a systematic solution of trying to find out, one, how to prevent people from being evicted in the first place. What do they need to help with their trauma and their crisis so they can keep the housing that they have? And then once they're in shelter, how do you get people back into that system by addressing those same exact things? And we see that there's different waiting lists across Iowa in terms of getting into therapy. So peer support, thank you for mentioning that. Peer support, we find that that's very helpful. People want to talk to people who understand what they're going through. And we do have peer support specialists across the state. Some of our PATH staff are certified peer support specialists who have been homeless themselves. So, when they're able to talk to someone as, hey, I've been there, I've done that, they're really listened to. They get a lot of respect for that and how far they've come, and it gives people hope, I think.
Erin, I think you really brought up a good point, is listening. And from the outside looking in as professionals, we see so many cases come across our desk that unfortunately they can't all start looking the same to us. And if we don't really sit down and listen, I have not lived any of these people's lives. I may have my own personal experiences, but if I bring someone in and I just listen and ask open-ended questions, they can tell me what their barriers are. What has worked for you? What hasn't? Tell me your experiences. And I may have surveys and I may have all these questionnaires, but in the end, if we are client-centered and client-focused and helping people make their own individualized housing plans, that's going to work out a lot better than me applying some sort of cookie cutter approach and telling them what their goals are and telling them what their measures of success are. Client-driven, individualized plans, and that's I think what we have learned over the years works best for those we serve.
I think it's hard to find funding. There's just really not a lot of funding sources out there to provide that long-term case management. So once they leave shelter and you get them into housing, having that case management piece, it kind of goes along to ensure that stability long-term is very challenging. For instance, the city just received 5 stability vouchers from HUD, and they were also had funding available to the continuum of care to provide case management for those stability vouchers. And our continuum of care is a 96 county continuum of care, the balance of state. And so they did receive that funding for the case management. Then we're told by HUD that was for rural areas. Well, Linn County is not a rural area. So even at the federal level, when these things do get funded, even at a very, and I want to say minimal, I know it is a huge expense, but for 5 families to receive those services, that we can't partner in the way that even the system was designed to work. So there's challenges continually, but I think once you get people in housing, the reason people come back and cycle back through homelessness is because they don't have those supports or that continued check-in with someone to make sure that they have all of the things that they need to be successful. And so we do have, I know Willis Stady has some permanent supportive housing, and there are little pockets here and there where nonprofits are doing that work, but overall, I think that long-term, when we really are looking at a housing first model, getting people into housing. We need to provide those additional supports to help them get stable.
You know, one of it is, as you said, it's the financial piece. And so we're trying, SOAR is the SSI access, you know, and recovery program. A lot of people have trouble, especially during the pandemic, even now, because providers are short-staffed, right? They're overworked right now and they're short-staffed. And to help somebody apply for SSI application with SOAR, which means you have a mental health diagnosis, you have a substance use disorder or both, or you have a physical disability, and you're either homeless or at risk of being homeless. They have a very broad definition of who is eligible based on what that definition is. And we are underutilized. What the dip in Social Security gave us the statistics, and the people that applied and were received SSI during the pandemic went down considerably. And we were underutilized even before that. So one of the positive things, honestly, is that agencies are sending their staff in to get trained in how to do SOAR applications and how to cut down on the time it takes for someone to receive those dollars. And in Western Iowa, they've found a solution with general assistance. So they get paid back for the staff time it takes when they're helping people with applications, because it does take quite a while. And providers, we have maybe 80 people trained in the state, but they're only helping people within their network because that's all they have time for. It's not criticism, right? We're not funded to do these. And if we could find funding, we would be able to help people get monthly income that they're qualified for, that would help them get into housing or help them pay for their own food and needs, and help them feel more reliant and more resilient. So I want to put a plug in for the necessity of looking at an individual's case. And if they don't have a monthly income and they're not eligible right now to work because they're not in recovery, then let's help them get SSI. SSI is a tool, it's a workforce development tool to get people into jobs, right? Because once people are safely housed, then they take a look and they're like, okay, now I feel better. I'm sleeping at night. I feel safe. I can go get a part-time job. So it's not a deterrent to working. It's actually an aid to getting people to work.
I will second your plug, Karen. Our rapid rehousing and permanent supportive housing staff are all SOAR certified.
It's important.
Yeah, so since a couple of you touched on coordinated entry, I'm wondering what challenges have you all had to navigate in collaborating and coordinating with, just the multiple entities, either, governmental or nonprofit service providers that are all involved in supporting those experiencing or at risk of homelessness?
Coordinated entry on the PATH side has changed a little bit on how we work, in the sense that right now outreach still happens. We're still doing street outreach, going to encampments, all that. But then it's helping people understand that they have to go through a housing assessment, right, in order to get on the list so that they can get subsidized housing, and making sure people understand what that actually is. And it's prioritized. So the benefit of it is that people with higher needs, people with children, people who maybe just aren't able to take care of themselves at all, they will score higher on the list, and then they would receive service first. It's a bummer though. We have to, the motto has changed for PAD staff, where I'm going to borrow this from primary health care. Kindness is clarity, right? Telling people the truth. We can get you on a housing list, but if you live in Des Moines, there are 500 names before you, right? That might take 2 years. And so coordinated entry has served a really valuable purpose as I see it from a state perspective. But we have to be very clear to not give false hope that it's a quick solution.
Yes, I agree with that too. I think it's really important to explain the process to clients. I agree with you, Karen. We don't want to give false hope when it comes to housing, because this is a tool to be utilized for them. But at the same time, it's not the only tool. So if there's other alternatives within the community that maybe be able to help them get housed, then we want to explore those options also. But I think it's really important to explain the process to clients and also explain to them what their level of responsibility is when it comes to that, when it comes to appointments and things like that. I think also when we think about the collaboration that we have within the community with other entities, a lot of times with us here, we're able to, shoot an email out to that case manager that may, have a scheduled appointment with that client. And so we're communicating to figure out if there's a missed appointment, and then we're addressing those things on the front end, to make sure that clients don't miss out on these opportunities. So I definitely enjoy the collaborations that we have with, being able to be on the same page with what the client needs and what supports we need to give through this process.
I would agree with that. I think that it's really important to continue those conversations and have that collaboration. I know we're probably on calls at least once a week, if not more often, just having these discussions, because when you're using that process, you're really able to see where there are gaps that need to be filled. And then we can have those conversations regarding, are there other funding sources that are available out there? Who could maybe help provide this type of assistance? What are you seeing, real time? What are those needs? And then when all of our other federal grants or state grants or the funding that has very specific requirements don't fill those gaps, we can talk to our philanthropic partners. It's like United Way, Greater Cedar Rapids Community Foundation, to come in and ask and make an ask to those agencies to really say, this is where we're seeing the gaps. Can this, agency do a program, a pilot program, and see how it works? And then we're able to kind of test those things out and then provide that information to our federal partners to say, this really worked in our community. You should really allocate funding towards this. And sometimes we'll see those things actually make changes in the federal programs as well.
And Two Rivers coordinated entry is working pretty well, I think, because the agencies involved have been together really since 2017, and we initiated coordinated entry in 2018, but we kind of worked together since the policy formation piece of it. And I guess Two Rivers is small enough, to five counties where we've kind of formed a cohesive bond and learned to trust each other. And we have quarterly meetings of the agencies, and we actually get a pretty good turnout of agencies, not just the access points who come, but we have on our agenda every time, what are the gaps and barriers? And, some of the barriers we know that, across our rural counties, there's a dearth of services, and the distances between them are far between. So those who need those services, the transportation barriers and some of the things that aren't funded are, sometimes car repairs and there's no public transportation, things like that. So we get to talk about those and where we can find funding for those, as has previously been mentioned. Some of the buy-in that that we did receive locally we're overcoming, such as the side doors, getting pressure from agencies when we've over time communicated pretty well. I think that we do have to pull people from the top of the list, the people who have the most vulnerability, and assign those to the case managers who have openings for supportive housing or rapid rehousing or the youth programs or the domestic abuse programs. Not just because you call the most often, or your agency has clout in the community, or we like you better than you, that sort of thing. There's been a lot of that subjective stuff taken out of it. One of the challenges that we have and how we're overcoming it is that there was no supportive housing, no permanent supportive housing in our region at all. And so everyone was being referred to rapid rehousing, which is basically a short, medium term rental assistance and case management program. And, we were having people who scored very, very high on the vulnerability index who had to be referred to that because that was their option. And it just wasn't being successful. And now one of the things that I failed to mention during my introduction was that a couple of the initiatives that we're doing, one is we just broke ground couple of weeks ago on a National Housing Trust Fund project here in Ames for an 18-bed housing unit for permanent supportive housing. And we were recently awarded a grant to do the same thing in Boone to procure and renovate a motel. So that's going to be an interesting project over there for, I think it's 36 units for permanent supportive housing and over there. So we know that supportive housing is the best practice for people who are experiencing chronic homelessness and also disabilities. So that just the advent of having that program here in Two Rivers has really helped with getting people off of that list and into the right housing program at the right time. So not just challenges, but some successes over the past 5-6 years of coordinated entry too.
Yeah, so I mean, with collaboration being so important and supporting those experiencing homelessness, Sarah, I'm curious from your perspective with the city, how can nonprofits and service providers and government entities ultimately be good partners? And, especially with the work that the National Alliance to End Homelessness has done, it'd be great if you could touch on that.
Yeah, and I've been with the city now for nearly 12 years, and I think that we've always had really good communications with our with nonprofit providers in our community. But I think from a governmental side, just being open to hearing the needs in your community and providing options and opportunities for folks to bring those needs to you, and trying to figure out again, we all want the same thing in our community. So how do we work together to figure these things out? And is it a funding source? Is it a program? Do we need to advocate for different legislation? Like having those conversations is just so important, and being open to those conversations is very, very important. And I would say from a nonprofit side, coming to your governmental agency and having those conversations and requesting those meetings to talk about those things in collaboration with the hopes that you're working together and that you're not coming in with the expectation that somebody else is going to solve it, but really coming with some ideas on, I have this agency and I want to help solve this problem, and here's how I think we can solve it. I think those conversations go a long ways in kind of like bridging that gap in the conversation. And that's not a blame game of, the city should be doing this or the county should be doing that or the nonprofit should be doing that. So it's how do we all work together to make it happen? Because I think what we learned through the National Alliance to End Homelessness, it was very eye-opening that we, sorry, somebody was trying to call me. None of us can solve homelessness by ourselves. This is definitely a community effort. And so having all of the different agencies coming to the table, which we did at that 2-day system design clinic, and just really had these honest conversations about where every single one of us could do better, right? And it's not anyone in particular's problem to solve. It's all of it's an community issue that we all need to work on and collaborate to make something happen. And so thinking about the National Alliance, one of the things that they used as they had a photo of a clock shop, and they said, we're all individual agencies in our great clocks in a clock shop. We're all doing, great things and on our own, but what we really need to get to is working as one clock. And so, that each agency is really a gear in the clock. And when somebody's just the slightest bit off, everybody else is going to know. And so that was just a really good analogy for me because we all do great work individually, but it's really working together as one clock that we really need to get to that point. And so having these continued conversations and figuring out how we can streamline processes. For instance, we have, I think, 3 agencies that provide rapid rehousing in our community, and each agency has a little bit different policies as far as discretionary policies. And so people were kind of picking and choosing where they were going to go to receive services. And so looking at that across the board and say, all 3 of us are going to provide services in the same way, so that when we're pulling people off of coordinated entry, it doesn't matter which agency that they end up going to or working with. And so that was just something that was very eye-opening coming out of that meeting. Hopefully I answered your question.
Yes.
Very long-winded answer. I'm sorry.
No, that's good.
I think the community partnerships, though, is key to that. And one of the things that has been really helpful to me at the state level in the alignment of the Department of Public Health and the Department of Human Services has been really working at the policy level with my coworker in the Substance Use Bureau, who oversees contracts across the state. And I want to mention that it's really important to know where are the sober living environments that we can refer people to. Where are the halfway homes? How do we get funding for people to stay in those? Because there is a cost when someone leaves treatment to get into them. Sometimes there's waiting lists, but we have to make sure that we're looking at both needs, not only the mental health needs and the trauma, but also the substance use, and then treating the whole person. And so I do think that we've seen some success with talking to each other, making referrals out into the community, cross-referencing, like who could go where, which one should be, treated, can we treat it as co-occurring? And there is some success with that.
And what I was going to add is one thing I've seen in collaborations within the community is that we've seen an increase in elderly individuals experiencing homelessness. And so up until a couple years ago, this wasn't really something that we saw a lot of. And so, our staff, we found ourselves, reaching out to the different nursing homes and trying to navigate that whole system on how do we get an individual, who's older, up in age, into these care facilities, so it's collaborating with the hospitals and the hospital social workers and, making ourselves readily available, to just really learn. So we have learned this process, and being able to collaborate with them has really helped to get some of those older individuals into some of that longer term care housing facilities. So a lot of times, when it comes to homelessness, you may not know what you're really getting into with that particular client until you really sit down with them and figure out what their barriers are, what their needs are. And once you start digging through, then a lot of things come to the surface. And so that's when those strong collaborations with other entities in the community really go hand in hand. And so we're really thankful to have a good process when it comes to that. We could shoot an email or give a call or set up a meeting. And like I said, we've started doing this with the hospitals and also with the nursing homes as well.
Well, then you don't have to be the expert, right? I mean, I think that's the thing that I found. I can't be the expert on housing and healthcare and criminal justice and all of these things. And so I think it's really important to build that network in your community so that when you have a client that has needs and you really don't have resources for them, you can reach out to that network and say, hey, this is what's going on. Do you know anybody or any services? And then we can start making those connections and building that network even larger. And because it's always learning, I've realized that healthcare has just as many acronyms, if not more, as our housing grants. So I thought I had a lot of acronyms, but it is definitely, you can't be that jack of all trades. So I think building that network is so important to find out if there are additional resources out there that even we don't know about after working in the system for, a decade.
Well, it's changing so rapidly, right? And I think, thank you for mentioning the older adults, right? That's so key. And then on the opposite end of that, right, we have people in foster care who are aging out of the system, and the statistics are bleak when you look at the percentage of people who leave foster care and become homeless between the ages of 18 and 25. And so there are some new things, that are happening. There's the foster youth to independence funding, where it allows public housing authorities to request housing vouchers to serve people under the age of 25. And those who have any history of being in the child welfare or foster care system are eligible, for those funds. But it's getting the word out, right? It's making sure that people know that that's available in their area and that they can ask for a voucher so that somebody can get housed. And that's one way to end, youth homelessness of foster kids, is to provide housing. But to go back to what Deneen said very early on in this, we have to address the gaps and provide supportive services, whether it's basic life skills, housing counseling, helping people learn not to feel isolated when they get into their apartment, and then employment training. How can we sustain this ongoing? It takes as Sarah said, not only a community understanding and connection, but a state one as well.
Yeah, so we have a couple audience questions I'll incorporate. One person who left a question appreciates the collaboration between entities and is wondering, how do people start researching the available services? Is there a place someone should start?
Well, I know Iowa.gov definitely has a lot of resources on their website. So a lot of times we'll print those out and we, make those available to clients and just to people in the community that may stop in, that have questions. So I think that's a good resource. Also going to these different agencies' websites and just kind of navigating through that to see what it is that they offer. A lot of times your local neighborhood association meetings and groups a lot of times meet and they have guest speakers that are talking about the work that they're doing in the community and those things. So I think just being active in your community and just knowing when these meetings or, different resources are being offered, and just reaching out to them. A lot of times we have people that come into our building that may not necessarily need shelter or may not necessarily, need to take a shower or do laundry, but just have questions. And so making sure that our staff is very knowledgeable about what resources are available so that we can share that information with individuals that stop into the shelter and also people that just call to ask questions.
And there's a lot of hotlines that are really important to guiding people to shelter and other supportive services, whether it's the Iowa Warm Line, that's a peer support run line. They know to where to refer, in the Cedar Rapids and Lynn County, because they're trained in that. They're trained in resource development. They utilize 211. 211 is another option for people to gain access to health and human service information. There's Your Life Iowa. That's a website and a number where people can call to get resource information. We have a lot of different places, but Iowa Concern is one that's really, it was started in 1985 and it's geared toward rural Iowa. And so there's more likely that somebody would call Iowa Concern if they live in a rural area because they know that number and they know it's been around a while and they know that there's a lot of agricultural stress and the counselors are all up to speed in some of that. So we do have a 988, there's a lot of things right now where different answers, right? There's not like one place a person can go to start that conversation. And I think what that says about Iowa is that we've really tried at every level to have a no wrong door approach. And so hopefully wherever a person calls, even if it's the wrong number, that person will say, hey, I'm not the person, but let me direct you to somebody else who is. We have the Office of Recovery Services through NAMI, Iowa. And, they advocate for people and they've done some really great work. So I think it's knowing what services are out there and making sure that there's no wrong door, that regardless of whether you are the correct person or not, you can help pass somebody on. And don't pass somebody on if you know there are no services there, right? If you know the shelter is full and there's no funding, don't refer there. Say, look, this is a future referral, but here's something you can do in the meantime.
There is an Iowa Housing Help State of Iowa coordinated entry website for persons experiencing or at risk of experiencing homelessness in Iowa. It's actually iowahousinghelp.com. You can go out there and peruse that website and get familiar with it. So that each region is also available to, there are access points in each region, but I would just go out and get familiar with this website so that if you know anyone who is experiencing or at risk of experiencing homelessness, they can just fill out this survey too.
And I know
that's a good one.
A lot of resources on their website as well. So if you're looking for public housing, they have a list of public housing you can search by your zip code. And so that information is out there. I know a lot of those have long waiting lists, but how getting in touch with the housing authority and finding out how people can get on waiting lists and things like that are important. And I would say even usually a city or county offices usually know where, if there's a resource list available, that they can hand those out. I know here in Lynn County, we have the Lynn County resource sheets that's available on Lynn County's website, but also through general assistance. So I think just, starting reaching out to those community partners and anyone that you know and start asking those questions. And people usually, again, starting to build your network and figuring out what else is available in your community.
You know, one of the great things I think, Linda, about the Iowa Housing Search website is it shows pictures, and that's just very important to people because then they can see the building and they can say, oh, okay, I can see myself there. And, that's something that I want to obtain. And so they do a really nice job with that. And I think having the pictures and the visuals of the place, it just makes it all much the better.
Yeah, well, housing search is as in the apartment search site.
Yeah. I refer a lot of people there.
Yeah.
Yeah. So, there's some mention, I think Deneen mentioned just the importance of like housing first in supporting those experiencing homelessness. So in this environment where housing can be a challenge to finance with inflation and labor constraints, what are some creative ways that you've seen communities leverage funding or other resources to create new housing for those experiencing homelessness, and also potentially like some supportive services element to go with that?
I can start it off. I've seen some groups using a model where they sublease units, which I think is very interesting. And we've been talking about that in our community too, about that potential option, because I know that there is such a challenge for people with very high barriers like past evictions or criminal record or other things that really keep them from obtaining housing. And so if a nonprofit can sublease a unit and kind of take that responsibility, and then as people move in and move out, that's something that I find very interesting, that they're kind of taking the liability for that, but then they're able to get a clients in very quickly and use their own system as far as who they're allowing into the unit and how they're screening their tenants in comparison. I know in Cedar Rapids, we've got like a 1.4% vacancy rate, and a 5% vacancy rate is a healthy market. So that, just means that there are more applicants for every apartment that's available in Cedar Rapids. And so that just adds to, that difficulty for people to accept somebody with high barriers or any form of subsidy.
And there's a cost to applying for to get somebody housed. And we did a loose figure through PATH. It's about $1,000, honestly. If you talk about the bat paying for the ID, helping people get the materials that they need in order to even go and fill out that application and how they get there. There's a cost to that. And we kind of view it as a kaleidoscope of service, right? Because one agency might pay for one piece and another one will pay for another. And so it's really important that communities continue to work together and work with the state, whoever it is that's calling, right? It takes so many different people to find the funding to even house one individual. And so leveraging that is a great skill, right? And part of that is just knowing how to know who the people are that you need. And I think the past staff work on that constantly, and there's a lot of turnover, so you have to constantly do it. How it looks today is not how it looked even 6 months ago, and so we have to be constantly updating and making sure that we know. And when I say we, I mean everybody, right, who wants to help somebody that doesn't have a home. That's really what we're talking about. And it's not one agency's solution. It's the entire state and all of us as community members. What are we going to do? What are we going to advocate for? And how can we do that in the best way that we're heard? And so that we can make a difference, because without housing, without supportive services, without access, and without that $1,000, right, to get people into the application process, we just keep talking about it. And the way to do it, the way to end it, that's what we all want. We want people to have homes. Is to get there through collaboration and honestly advocating at the federal level and the state level, so that it's understood what those issues are and how do you get past trauma way before a person becomes homeless, so that they don't end up having trauma and sleeping behind a dumpster behind a quick shop.
Well, I think we'll probably see some other things come out of the emergency housing vouchers that HUD provided during the pandemic. And I'm sure they're going to be doing additional research on how that program worked. But up front, they provided the city of Cedar Rapids, well, Lynn and Benton County. We had 44 emergency housing vouchers, and we had to partner with the continuum of care to work with local agencies through coordinated entry to provide vouchers for people experiencing homelessness. And so we were able to house all of those folks. And how we were able to do that was HUD provided funding for each household that allowed us some discretionary policies regarding how we were able to spend that admin money. And so we were able to provide a landlord with an upfront payment to, like in order to take a higher barrier tenant. So we were able to pay up to a certain dollar amount to a landlord to accept somebody that's more high barrier. We were able to provide 2 months of deposit assistance. We were able to pay past utility bills so that people could get service hookup. And I think that's the challenge, is finding that flexible funding so that people can really fill the gaps depending on what the actual client needs in order to either get the housing or like paying some of those past things, or like you said, the application fees. That's huge here in our community as well. So having that flexible funding is really important. And I think that was a great pilot program, but it's like, why did it go away? I understand it was during the pandemic, but I think that's something that is needed in probably every community. And I think they'll see the success in that program. But I think, again, now we're kind of transitioning into stability vouchers and having that longer term case management that is going to go along with those. So hopefully HUD is really doing some additional research on those programs and identifying like what was successful and what was not. And hopefully we'll have some longer term programs that will be allowed through that federal funding source. Because it's really impossible to do that at even at a state level. It's very difficult.
And I think the managed care organizations play a role in this as well, right? Because if a person is on Medicaid, if they're getting SSI, a lot of people don't know that their insurance company has behavioral health services. We provide IHH services, teams to people who don't have homes. We do that. Iowa Total Care, for example, has housing navigators. They help advocate for people to prevent evictions. They've gone to court with individuals and showed them how, to respond to the answers. And they do provide some of the case management. And so one of the first things I always ask is, do you have Medicaid? And if you don't know who your provider is, let's find out who it is so that you can access and have paid for maybe transportation to some of these things. There's a whole host of things that the managed care organizations will pay for in regard to behavioral health. And it's just educating people on how to ask and how to utilize those services and advocate either for them or for them to advocate for themselves.
Cool. Well, I know we're almost at time, so we'll begin kind of moving into the final question here. I did want to acknowledge an audience question asking to comment on the correlation between homelessness and mental illness. How could Iowa do better in addressing this? If someone wants to touch on that briefly before we go into kind of final takeaways.
I'll definitely say that there's been an increase in mental health struggles with individuals experiencing homelessness. Right now, 75% of the individuals that are checking into the shelter are identifying with having some form of a mental health component. And so I think within our community, what we need is more mental health services that are available to individuals. Is it a situation sometimes where the mental health services, your appointment is, pushed back a couple months, where it may take a little while to even really get an individual in. So the more services that we have within the community and the more so that we make them available for clients, I think, we'll see more success. Even the point of how do clients get to these appointments? I think Karen kind of mentioned, making sure that if the individual has that Medicaid piece, are they signed up for those rides to get to and from those medical appointments? And so just making sure that we're navigating through whatever resources are available in our community, and then also advocating for, more services that are needed. even when clients get into their own housing and they're off on their own, what's important for us as case managers is making sure that we've created, like a housing plan of what they're going to do once they are into their housing, making sure that it's set up for them to get transportation to and from these appointments, making sure that they understand, and know who their providers are so that they can reach out to them. And I think somebody else kind of touched on this a little bit in talking about how do you help individuals to maintain, to stay in their housing. And I think one way of doing that is making sure that we've created a community, of different services that are available for them. A lot of times we see individuals cycle back into homelessness because they're kind of still, associating with those individuals that are homeless and then bringing them into their home. So creating a level of community and introducing them to other things that are available, other resources, and making sure that they understand where these places are and who their providers are.
And if anyone else wanted to weigh in on that, you can kind of do so in your kind of wrap up response. But before we sign off here, I'm wondering, what do each of you see as Iowa's greatest opportunities for investing in true support for those experiencing homelessness, and what would ultimately need to happen to end homelessness in Iowa?
Who wants to go first?
Easy answers, right?
Yeah, one thing that we keep going back to in our area is talking about lawful sources of income, because being able to have the ability as a community to identify lawful sources of income as part of our civil rights ordinance, I think helps provide protections for households that are trying to utilize different sources of income to pay their rent. And I think by not having that opportunity in our community, even individuals that like literally have no criminal record, maybe elderly and have a Section 8 voucher, are not able to lease up because landlord just can choose not to accept that as a lawful source of income or lawful source of payment for rent. So I think that is something that would definitely assist households in utilizing funding sources. Obviously, landlords still have the right to screen their tenants the way they would any other tenant, but they just have to use that lawful source of income as a lawful source of income when they're looking and calculating their ability to pay rent. So that, I think that I see that as something that would be very helpful. We saw success with that in the city of Marion when they had that in their ordinance. That would be my one takeaway.
Whoever would like to go next.
Well, I guess I can chime in. So thinking about what do we need in our community to end homelessness, I think that we need more housing, and more housing that's affordable for individuals in our community. And then we also need those wraparound services that are going to help them to stay in their housing. So having more funding for these agencies that are able to provide those services, I think will help to kind of bridge that gap, to be able to provide that support. But I think that's really what's needed.
And helping people upstream, right, before they end up in a situation, whether it's domestic violence, whether it's we see people who have lived with one individual and that individual dies and they're not on the lease and they don't have maybe the skills. So helping people all through the spectrum, right, with their mental health, with their substance use, making sure that as Neen said, that these are readily available. There are waiting lists. So there's alternative methods, that we have access centers now. We have 23-hour observation centers around the state, knowing how to utilize mobile crisis and how to access that, and helping people at the crisis point, sending them maybe to respite so they don't end up in a higher level of care. We have Rhonda's House in DeWitt as an example of a peer-run place where a person can just go and they can stay there for 5 days and just get support and help. And I think it's just knowing what is available and listening to what that individual needs, and then letting them know what's available, and letting their friends and family know if they're contacting you, because there's so many different things that are new that people don't know maybe how to access. And so I really believe that it's a systematic opportunity for all of us, everyone here, right, to learn and keep learning what's available, so that we can guide people to the point where they aren't without a house or without an apartment or without a car, any of the things that they need to function going forward.
I would say that I would like us to not lose our Iowa Council on Homelessness. I think that would be great. I think that would be great if our state could focus on increasing funding for things like the Shelter Assistance Fund. Any policy efforts toward improving housing efforts, affordable housing, so supportive services, prevention and early intervention, basically systemic changes, and advocating for collaboration among the various stakeholders across the state, all of those things.
And language too, right? We want to be positive in our language, and I've tried to start saying people without homes, and
Exactly.
and because there's a stigma right now when we say homeless. There's just this automatic stigma, and we can do better than that, and we can get past that. But it takes all of us to have positive language.
That's right.
But just education in the public in general, I think it is helpful, and people understanding why people become homeless and what the issues are, what the barriers are. I think people have, like you said, a stigma, preconceived notions of what that is. So
yeah.
Well, thank you all.
People that are homeless are just like us, right? They're just like us, but they've had something that derailed them, and they don't want to be doing what they're doing. They do not want to be unstable and feeling unsafe at night, and none of us want that.